A Metro Atlanta mother lies brain dead in a hospital room, being kept alive only because she's pregnant.
Been on a ventilator for the past 90 days.
They don't care if women die.
This was about Georgia's controversial heartbeat law.
This is Adriana Smith, a 30-year-old mother and a dedicated nurse. Why has her life and tragic fate ignited a national uproar? What does her story reveal about medical ethics, experimental treatments, racial injustice, and the real consequences of restrictive abortion laws? Stick around, because this is more than just a headline. It's a question America can't ignore.
Welcome back to our channel. I'm Haas.
I'm CeCe.
Today we got a hot topic for you. Adriana Smith went to the hospital in February with what she thought was an intense headache. And at the time, she was about 8 weeks into a pregnancy. The hospital didn't bother to thoroughly examine her. They didn't do any scans, and they basically just did a really basic check like blood pressure and stuff like that.
Gave her some medication, but they didn't do any tests. Didn't do any CT scans. If they did, they would have caught it.
The next day, she woke up gasping for air, so her boyfriend called 911.
Smith was taken to Emory Decatur and later transferred to Emory University Hospital, where she worked as a nurse. A CT scan revealed multiple blood clots in her brain.
And she had blood clots all in her head. So they had asked me if they could do a procedure to relieve them, and I said yes. And then they called me back and they said that they couldn't do it.
And she was eventually declared brain dead.
I feel as if somebody dropped the ball at the hospitals, and her boyfriend asked, please keep her. If she was kept at the hospital, we wouldn't be here.
At the time, she was about 8 weeks pregnant. Despite her legal death, she remained on life support, not because of a medical necessity, but due to Georgia's stringent abortion laws.
Emory University Hospital is enforcing Georgia's heartbeat law, which bans abortions once fetal cardiac activity is detected, typically around 6 weeks of pregnancy. The law grants personhood to the fetus, compelling medical staff to prioritize the fetus's life over the mother's, even in cases of brain death. Fetal personhood is a doctrine that holds that embryos and fetuses should be considered people, and as such are entitled to full legal rights and protections.
Last year, the Republican Party approved a party platform that supports states using the 14th Amendment to establish fetal personhood. If that's written into law, it would effectively ban abortion at every stage of pregnancy, and it could have opened the door to criminalizing IVF and further empowering the prosecution of abortion under state criminal codes. And increasingly, that's what we're seeing across the country. Republican lawmakers in at least 10 states have introduced bills that define abortion as homicide. In some states, those laws have led to the prosecution of women who've miscarried, handcuffed just hours after suffering from this health crisis.
April Newkirk, Adriana's mother, said doctors told the family the law requires keeping her alive to preserve the pregnancy.
Adriana Smith's family says they've been forced to wait without a voice while doctors try to keep her body functioning long enough to deliver her baby.
Because I'm in my 50s, her dad is in his 50s, so we're going to have the responsibility with her partner to raise her sons, you know? And I'm not saying that we would have chose to terminate her pregnancy. What I'm saying is we should have had a choice. We should have had a choice.
Georgia's abortion laws have evolved over the years. In 2019, House Bill 481, known as the Living Infants Fairness and Equality Act, was signed into law. This legislation bans abortions after a fetal heartbeat is detected, effectively outlawing most abortions after 6 weeks of pregnancy.
While the law includes exceptions to save the mother's life, it offers no guidance in cases of brain death. This legal ambiguity has led to situations like Adriana's, where medical decisions are influenced more by legal mandates than by medical ethics. And it poses some serious questions. One such question being, is allowing the mother to pass away naturally really the same as administering an abortion? And what about bodily autonomy and the prioritization of fetal rights over the rights and dignity of women?
And now, Adriana Smith, a pregnant Black woman who is sadly brain dead, is the first person in Georgia to be kept alive to incubate a possibly non-viable baby against the family's consent. And it's not that the family wanted to remove Adriana from life support, but they wanted to have the choice.
We should have had a choice. We should have had a choice.
And this is where the experimentation occurs, because the brain is dead, but who is to say that everything the baby needs is being produced to make the baby healthy? Who is to say the period of time when Adriana's heart stopped, that the cut in oxygen didn't affect the baby? These things should be allowed for consideration if the family is being forced to take on this responsibility.
This situation echoes the 2014 Texas case involving Marlise Munoz, who was brain dead and kept on life support for about 2 months because she was pregnant. Munoz's husband sued the hospital because it would not remove the life support as he said his wife would have wanted in such a situation. A judge eventually ruled that the hospital was misapplying the state law and the life support was removed.
Now, to be fair, there have been instances where a mother was placed on life support and a healthy baby was delivered.
In a 2021 review co-authored by Dr. Vincenzo Bergula, cited that he scoured medical literature going back decades for cases in which doctors declared a woman brain dead and aimed to prolong her pregnancy. He found 35 cases, of which 27 resulted in a live birth, with most of the babies being declared healthy.
But Bergula has cautioned that Adriana's case is much more difficult because her pregnancy was far less along than the women in his study. In the 35 cases he studied, doctors were able to prolong the pregnancy by an average of only 7 weeks before complications forced them to intervene, as it's very hard to prevent infection and cardiac failure in these situations.
Now, this case is the first of its kind, and you kind of have to wonder if it is indeed some sort of experiment to see how long a fetus can survive in the body of a brain-dead mother. And you also have to wonder if the law is being applied so rigidly because the mother is Black.
This isn't a new issue. Historically, Black bodies have been exploited in the name of science for years. From the unauthorized use of Henrietta-Lacks cells to the experiments conducted by Dr. James Marion Sims on enslaved women, to the Tuskegee experiments, just to name a few, Black individuals have been subject to unethical medical practices without consent for centuries.
Now, as we mentioned before, Adriana's family is not directly advocating for her to be removed from life support, but they do feel they should have had the choice. But Georgia laws complicate their ability to make that decision. The fetus, now named Chance, continues to develop, but faces serious health risks, including fluid on the brain that could lead to disability or death.
Medical experts argue that continuing life support in cases like Adriana's isn't legally mandatory. The ambiguity of Georgia's laws has led to ethical dilemmas, where the rights of the mother are overshadowed by the legal status of the fetus. Adriana's story is a stark reminder of the intersections between race, reproductive rights, and medical ethics.
Adriana Smith's story is not just about one woman's tragedy. It's about a system that needs to change. It's a call to examine how laws and biases shape the healthcare experience of Black women. Black women deserve to receive respectful, timely, and competent care. It's not just a medical imperative, it's a moral one. Let's make sure Adriana Smith is not another statistic, but a catalyst for meaningful change in how the healthcare system treats Black women. It's about time we listen, learn, and act.
To learn more about how you can support Black maternal health and advocate for ethical medical practices, visit the links in the description below. And in the meantime, adventure seekers, be true to yourself, keep your mind sharp, be patient with your neighbors, be the change you want to see in the world. Peace.